Yikes. This Conyers bill saying must be socialized medicine. You're going to hear that. This is socialism. If we go to socialism, you've heard it already from, I haven't listened to Russ Limbaugh. How many of you listen to Russ Limbaugh? You've probably heard it, right? This country's going down the road of communism, if not socialism. Well, it isn't socialism. You know, we're not talking about 676 being socialism. It is Medicare for all. Many of us on here are on Medicare. I am. How many else are on Medicare? How many think that that system has worked reasonably well? I would say so. It's got some holes in it, like the drug business, the drug plan, D's have got some holes in it. How many of you had to? Well, I'll ask that question later. But Medicare has worked for 40 years, providing good quality care to those of us in the age group where it's appropriate. It is not a socialized system, and we'll talk about that, but it does allow patients to choose their doctor if they're in the regular program. It certainly allows the doctor and the patient to choose the plan that they want. They have the treatment plan that they want. And we all know that it's the Medicare Trust Fund that pays most of the bills. Now there is copay, and we do pay something out of our Social Security, so there are other costs. We accept that. That's the price we accept for a system that will give us the care we need when we need it. Frankly, that's as American as apple pie in my book, because that is an American system. But it's not socialism. We do have several socialized programs in this country, and one of them is interesting. The Department of Defense is a socialized system, right? It's the best medical care system if you happen to be a soldier in the world. I mean, people get shot in war. But our system will prevent their dying at a rate that is unheard of in the annals of human history. People don't die because they get treated quickly in a very outstanding system, which is a socialized system, owned by the government, paid, everybody in that system is paid for by the government, and the only people who are eligible for that system happen to be soldiers or military people. The VA system started after the Civil War because people were sick, and clearly the VA system is a socialized system, owned by the government, the people who provide the care are paid for by the government, and the only people who get in the system are people who are eligible for it, who are veterans. The Indian Health Service is another one, and it's not quite as good. The Bureau of Prisons is a socialized system. The government owns the prisons. They own the prison hospitals. They pay the public health service doctors to provide care. Why do they do that? Because prisoners are the only people in this country who must receive quality medical care as a function of their constitutional rights. Does that surprise anybody? How is it that we provide constitutional rights to health care to the least of us, if you will, to those who many of us would like to throw away? Sheriff Arpaio and the county of Maricopa expends over $20 million a year. Now it's $25 million. When I was there, it was less. To serve the health needs of the 10,000 people in that jail. And they do it not because they like to do it, not because they like spending taxpayers' money. They do it because if they don't do it, there'll be a federal lawsuit on their door to provide quality care to the people they've incarcerated. That seems to me to be an extraordinary situation where we have three high-quality systems in this country providing health care. And yet, those are socialized systems. Medicare is not a socialized system. And yet when we talk about, when people argue to have Medicare for all, well, said, oh, it's socialism. It ain't. It is not socialism. Don't let people tell you that. For patients, everybody would be eligible. You can pick your own provider, and the doctor and you will choose the care you want. That's what you want in a health system. For the doctors, I argue that 676 would be a lot better than what we have now, because anybody could join up. Any doctor would be whose license would be available could be part of the system, not like today where you have to sign on to a health plan. And you and the patient make the decisions about a wide variety of services. Not like today we have to call Cincinnati and talk to somebody who may have a high school thing. Can I send this patient to the hospital? I'm sorry, no, it's not included, doctor. How should a doctor be told what to do by someone with less experience and less knowledge and doesn't know the patient? That's outrageous, and yet that's what happens today. That won't happen under 676. Quick reimbursement fee schedule will be negotiated. We can talk about that later. I don't want to get into it now. And they can choose the payment method, but the most important thing is, today in this country, every physician in practice, is employing between 4 and 5 other people, most of whom provide no clinical services. Those 4 or 5 other people are employed simply to move the paper, to make sure that the bills get sent to the right insurance company, that they're filled out under the guidelines of that insurance company, and that when they don't get reimbursed, that there's somebody to call up and say, why haven't you sent the money to us? That amount of overhead is costing everyone, including the private medical community, a huge amount of money, and that will go away. Now, facilities will be paid on a whole different basis, and I'm going to go through this quickly because I think I'm running out of time. Basically, we would find another way to pay hospitals than simply the fee-for-service system that we now have, or the discounted fee-for-service system, which is what's common. We would do it like so many states do with Medicare, or with Medicaid. And that is to essentially say, to develop a cost per day and then count the number of days. We can talk about that later on. The beauty of this system would be that the hospitals would not have to worry about sending bills. They would send one bill at the end of the month saying, these are the patients we treated, this is what we did with them, this was the discharge diagnosis. Just what they do today. They're doing that today. That system is in place. Every state requires that hospitals tell them what they've done last month. So there's no extra cost. But they could get rid of the number of people in hospitals. There's one person for every bed today in American hospital system processing the bills. They don't ever see a patient. What they see is the bill, and they make sure it goes to this company or that company, and then it's made out appropriately to increase the reimbursement. That's an inefficiency that we need to change. The beauty of this would be that we wouldn't have the kind of problems that we see, and you've read about it in the paper, where a patient who can't afford to stay in the hospital, if they have no other way of being paid, may end up being shipped to some other country where they happen to come from, simply to get them out of the system and not cost the hospital money. That is unethical, unreasonable, irresponsible, and yet it happens every day in this state and in other states. That won't happen.